Hi, it's Adrian Kat from Advanced Dental Artistry. So what can go wrong when getting treatment done overseas? Well, we live in Australia and many people actually consider going into Asia to get treatment done. I suppose because we're working in Australia and get to see a lot of these cases come back, there are a lot of problems we actually see. I think one of the most important things is we always hear of the lack of communication and planning when it comes to this treatment. For example, if we're doing cosmetic treatment or all-on-four dental implants, it can take sometimes up to 4 weeks to plan a case. When a patient comes in, we need to, for example, implants, take bone scans, we need to plot the exact position for the implants. And not only is it the implants, but the implants also dictate the type of bridge or the tube that's going to go over the top of the implant. So it's not as simple as just turning up and taking an x-ray and just putting an implant in. In a lot of these cases, they need to be planned really well. When it comes to cosmetic treatment, the communication is very important of what the patient actually wants. How white do they want their teeth? How long is the final cosmetics exactly what they wanted when it comes to their treatment? What happens in these cases, especially when it comes to dental implants, is of course, or all-on-four treatment, is of course failures. If we see a failure with a dental implant, there's two failures we see. One is of course a biological failure where the implant actually doesn't take and the bone actually dissolves around the implant. Therefore, when the implant needs to be taken out in Australia, the problem is there's no bone to actually place a new implant in. The other problem, of course, is breakages. If we see breakage of an implant crown or an all-on-four bridge, it is very, very hard to repair this. The most important problem we're having with dental implants now is that a lot of these implant systems are not available in Australia. All dental products and medical products need to be TGA approved. And if dental products are not available in Australia, we can't touch or treat these patients because we can't get the components in order to do that. When we see failures in cosmetic treatment, the most common one is patients will come in and say the smile is not what they wanted. And again, the main problem we have here is communication, a lack of planning, and a lack of time to test run the new smile before the final porcelain is actually made. If there is breakages with porcelain treatment, unfortunately the only thing that we can do is to replace the porcelain, and it can sometimes be one or multiple teeth. I think with all cases, especially when it comes to complex treatment like cosmetics or dental implants or all-on-four treatment, is communication is very important, and secondly, review. We need time in order to review all the cases that are done so that we can ensure that the patient one is happy. But secondly, if there's any changes to the bite, the cosmetics, or the phonetics of the case, is that we have time in order to make these changes. With dental implants especially, the 3-month check is critical. If you have any questions, please give me a ring at 1-800-SMILING. I look forward to one day seeing you in the practice.